All right, we're streaming live on YouTube, so I will get us started. Thanks for joining us, everyone, at another media briefing. Today is Tuesday, July 21st. We're joined today by Medical Officer of Health, Dr. Hsiu-Li Wang, and Regional Chair Karen Redman, who will give us some updates. And since we are between CAOs right now, I will be giving a brief enforcement update. So I will pass it over to Dr. Wang. Go ahead, Hsiu-Li.
Good morning, everyone. The overall status of COVID-19 remains relatively stable in Waterloo region. As of this morning's dashboard update, we have 53 active cases. A total of 46,395 tests have been performed in Waterloo region, with positive results for approximately 2.9% of all tests. A total of 1,194 cases, or 87% of positive cases in Waterloo region, are now resolved. There is currently one outbreak declared in a long-term care home and no outbreaks in other congregate settings or workplaces. On Friday, Waterloo region moved into stage 3. We were able to do so because of the efforts of our residents to slow the spread of COVID in our community. But with stage 3, there are new opportunities for the virus to spread. We have not eliminated COVID-19. The potential for increased cases and outbreaks remains. We know that the virus spreads more easily in indoor settings and when people are in close contact with others. That is why physical distancing, frequent hand washing, and staying away from others and at home if you have any symptoms is essential. We must continue to learn to live with COVID-19. This will be our new normal for quite some time. While gathering limits have increased for social gatherings, I encourage you to keep the number of people that you visit with small, especially in indoor settings, and continue to practice physical distancing with everyone outside of your social circle. To borrow a phrase from Dr. Bonnie Henry of British Columbia, more spaces, less faces. In closing, I am very grateful to our community for its adherence to the masking bylaw and for the hard work and sacrifices many of you have made to get us to stage 3. I would like to thank our community and healthcare partners for all of the work that they continue to do day in and day out to serve our residents. I would also like to take a moment to thank staff at the region of Waterloo. They have adapted their practices, adjusted to our new normal, and like many of us, have continued to make personal sacrifices to help slow the spread of COVID-19 in our community. We all have a role to play in helping our community move forward in stage 3 and beyond. What comes next depends on the actions of each and every one of us. We have seen what can happen when citizens stop adhering to public health practices, not only south of the border, but also in other places in Canada, such as in BC and Alberta, where infection rates have started to rise again after a period of low rates. As we begin stage 3, we must not let up our guard. We must not take for granted what we have been able to gain through our collective efforts. Let's continue to protect each other. Thank you.
Thanks, Dr. Wang. I will pass it over to Chair Redman. Go ahead, Karen.
Thanks, Bethany. Now that face covering bylaw has been in place for a full week, I want to provide a brief update on wearing masks in Waterloo region. We're very pleased at the amount of support we've received for mask wearing, mandatory mask wearing. I've seen a drastic increase in the amount of people wearing mask coverings in enclosed spaces and on transit. For residents in need of a free mask, we know that most local social service agencies are providing them to clients at no cost. Free fabric masks are also available from Grand River Transit, Cambridge Memorial Hospital, emergency shelters, and welcome spaces at regional buildings. Our local United Way Waterloo is collecting donations and organizing the distribution of free masks to citizens who can't afford one. If you can donate masks, please contact that United Way. Please remember to show kindness to those unable to wear a mask covering. Children under 5 and people with certain medical conditions or disabilities are exempt from the face covering bylaw. If you see someone without a mask, please assume they have a good reason for not wearing one. Finally, I want to stress that wearing a mask covering is just one of the public health measures that we need to follow. Physical distancing is still required in order to stay safe. Wearing a mask doesn't mean you can get closer to people outside of your social circle. Always stay 2 meters or 6 feet apart. Wash your hands thoroughly and often. Stay home and get tested if you have symptoms of COVID-19 or have had contact with someone with COVID-19. If you still have questions about wearing mask coverings, visit our website where we're adding new questions and answers every day. regionofwaterloo.ca/maskbylaw or regionofwaterloo.ca/maskbylawbiz, B-I-Z, if you're interested in finding out what the rules are for businesses. Thank you.
Thanks, Karen. So I'll go ahead with an enforcement update. It will probably be brief, and I will give you a quick update on the mask bylaw and then a general enforcement update. So as far as the mask bylaw, our bylaw team is reporting really good compliance and not a lot of major issues related to the bylaw. So we don't have specific stats around compliance at businesses and operators, but we do have some data that I'll share. So bylaw enforcement has had 438 questions and complaints about the mask bylaw since July 6th. So these have come in via the website, via email, phone calls, and our call center. And they've been sort of a variety of questions, mostly about people not wearing masks, conduct in stores, and various questions about retailers and customers. So moving on to Grand River Transit. So GRT staff are also reporting very high compliance on buses and trains, which is great news. Drivers, security staff, and management continue to provide bylaw education, and free mask distribution continues this week. And Karen has been participating as well, so giving away GRT masks. So general update on enforcement. So there have been, since the last update that I believe Julie gave on Tuesday, there have been no new charges, no significant issues noted regarding stage 3 reopening. There has been a lot of education and support for operators and businesses to successfully reopen. So as far as numbers, there were 217 site visits, just for education and sometimes warnings, no enforcement action as I mentioned, and then there were about 50 site visits with no action required. So that's the enforcement update, and I will open it up to media for questions now. Let's start with Tim.
Hi, good morning. So my question is for Dr. Wang. Younger people are testing positive for COVID-19 in Ontario. Do you know if there's any trend like this in Waterloo region?
You're on mute.
Sorry about that. Thanks, Tim, for the question. Because our numbers have been, relatively low recently, we haven't really identified that as a trend. We are seeing that, as there are less infections picked up in older groups, there are more infections picked up in younger groups. But, what we've seen elsewhere in terms of a high number of young people not respecting social distancing rules, for example, isn't something we have picked up in our data at this point. But we're going to continue to monitor. And we've had a couple of cases, but they don't explain the large majority of cases. So we'll continue to monitor that because it's definitely a phenomenon that I think we're also at risk for here. So we just have to continue to monitor and reinforce the messaging about what happens when people are less vigilant with their practices.
Now, expanding on that, what are the concerns for public health for younger people transmitting or catching the virus?
Yeah, so in general, for younger people, they tend not to get as sick, but they can just as easily transmit to others. And what we have seen elsewhere is that they can transmit to a large number of their friends, and then they can indirectly transmit to members of their family and close friends that are older, and that can have serious complications. So they may feel the risk is not so much an issue for themselves, but they end up impacting other people just as seriously.
Okay. Now we're hearing some mixed opinions regarding stage 3, and with the mandatory bylaws in place for indoor settings, has it been difficult at all to enforce someone to wear a mask, maybe let's just say while they're eating a meal at a restaurant?
I don't know if that's a Dr. Wang question or me, but I'll wait in a little bit, Tim. I mean, quite clearly, it's counterintuitive that you'd wear a mask when you're eating and drinking. I think establishments are looking at a protocol of physically separating tables, asking people to stay seated, not walk around. It's one of the problems that's been reported in other locations when people are in bars drinking, is that, you have a couple drinks and then you feel very sociable and they're not doing that physical distancing. But restaurants are doing the deep cleaning. So they're the ones that I think are being particularly vigilant in, certainly in a restaurant setting. Some businesses demanded masks even before the bylaw was in place. Others are handing them out at the door. So the reason that we have the website that says biz is because so many businesses want to comply and they want to know how to comply. So we're really encouraged with the uptake. It's certainly been supported by the local chambers of commerce and by Best Waterloo Region. So we feel that there really is broad support for the economic recovery, that businesses recognize they have to comply. I don't know, Dr. Wang, if you want to add to that.
I think that was really well said. Yeah, we're very pleased with the compliance, and our assessment is businesses do want to comply, and they do have other measures that they need to put into place, such as physical distancing and environmental cleaning.
I just have one more question. I noticed that there's a proposed secondary school plan for this coming school year. It was released from the Waterloo Region District School Board. This proposed plan, is it the right route for our local schools, if you have seen it yet or not?
I haven't personally seen it. It's possible that our staff have seen it. I do know the government has asked school boards to prepare for different scenarios, and that the Ministry of Education is waiting on some recommendations from the Ministry of Health that will then be given to the school boards. And then local public health will have a role in helping school boards implement locally and address any local implementation issues. So I don't have any comment about that plan at this point in time.
And I guess, Tim, if I could just observe, and I haven't seen the proposal yet either, but as a family where we have 5 kids and grandkids in the elementary school system, I think parents are looking for certainty and clarity. So despite the fact that there are 3 different scenarios, I would think the parents would welcome at least being able to envision what childcare might look like and working from home might look like. So I think the more information parents get, generally speaking, it provides some certainty that allows them to make plans in their own family.
Yes, it's very good that they're doing this planning.
Those are all my questions. Thank you so much.
Thanks, Tim. I will pass it over to Nicole from CTV. Go ahead, Nicole.
Hi, this is a follow-up to Tim's question. So I'm just wondering, the Ontario Public School Board Association, the head of that association says, public health units should most certainly already be involved in the planning with local school boards regarding back to school plans. Have you provided any advice in terms of, you know, hand washing, physical distancing within the schools, and, you know, wearing face masks in class and whatnot?
Well, there's overall guidance, and that's being provided by the Ministry of Education based on advice from the Ministry of Health, and it's done this way so that there's consistency across schools across Ontario. When you have 34 health units, there's a possibility for 34 slightly different sets of guidance, and we don't want that really to happen. And so, local public health units are definitely going to be involved in the planning, but within the framework of the guidance that has been provided by the province. That way we can make sure that our recommendations and advice are going to be aligned, with the province's overall direction, while helping our individual school boards and schools tailor their plans to fit their particular settings locally.
And has there been any request yet by any of your boards for, I guess, any regional or municipal buildings to help deal with the physical distancing if students must return full time?
They are looking at their own physical layouts and plans, and they have the general guidance already from the Ministry of Education, and my understanding is they're actually, trying to operationalize that right now. So, there are questions that they may not necessarily need public health input on because they have the general guidance. They just have to figure out how to implement it. But of course, as I mentioned, once we have the general framework, we will be involved, and we will be able to help them meet the requirements that have been laid out for all schools and school boards.
Jumping to childcare, because that's going to be a major issue once the plans come into play. Is the region considering, I guess, fast tracking parents who want to provide home childcare? Because we're hearing that there is a lack of home childcare services across the province and in Waterloo region.
So I know we're in negotiations and talks about the fact that we need more childcare, but Nicole, that's pretty operational. So I guess I would have to ask you to redirect to Douglas Bartholomew Saunders, who's the commissioner of that area. I know we are looking at distancing, fewer kids in childcare settings and deep cleaning. So specifically about more in-home childcare, that's a question that he could answer.
How about regular spaces within, I guess, the childcare facilities, not just the home childcare? Could there be more spaces opened up somehow with physical distancing?
So again, one of the things that we did was offer free childcare during the height of the pandemic to frontline workers. The province asked us to continue to provide that childcare. So we had 3 centers that were providing that childcare. So that displaced people who were regular attendees there. So there's been a little bit of redistribution of those kids. Parents who had places were told that they could continue to have places. And again, not to over personalize, but 2 of my grandkids are supposed to be going into junior kindergarten this fall. Is there going to be junior kindergarten? So our daughters are looking at whether they give up those spaces. So again, I think there's a whole lot of moving parts. There's a lot of fluidity. And I think the region is trying to work with partners in the community to make sure that we can expand the spaces, because clearly there will be fewer children at each childcare center.
Anything further, Nicole?
No, I'm good. Thank you.
Great. Okay, I will pass it to Kate from CBC. Go ahead, Kate.
Thank you. We are hearing again that wait times for testing results are creeping back up. Some people waiting as much as a week. Dr. Wang, what are you hearing from the hospitals and the testing centers, or even the public, in regards to this?
There continues to be a strong demand for testing, which is a good sign. I think it can be challenging on a short-term basis sometimes when people there's a lot of people wanting tests, and maybe there's not that much capacity at that moment. But I think that I think our partners our testing partners are actually doing a very good job in trying to respond as much as possible to that increase in demand that we've seen in the region. So we've seen that the drive-through center get up and running, and we've seen a significant increase in the number of tests that have been able to be conducted since that drive-through went into operation. So that's very good. I would ask patients to continue to be patient for now. We understand that everyone would like to get an appointment faster, to get the results a little faster. But across the province, there has been this significant increase in the number of tests that have been performed, and that's always going to lead to some degree of increased delay in the shorter term, while partners try to respond to the increased demand. I'm pleased, though, people are continuing to seek testing. That's important. And as we've seen, our percentage of tests that have come back positive over the number of tests that have been performed has continued to go down, which is a good indicator.
So does this sort of go back to a couple of weeks ago, we talked about how the labs are still trying to build within their system?
It's still the case. I mean, the volumes have increased provincially since the last time we talked as well. And again, it's still a lab system that, it's expanded, it's gotten stronger, but we've never tested at these volumes before in the province. And so this is something that's going to continue to, require some tweaks as we go forward to get to a smoother state.
And then, Dr. Wang, if we see cases go up, is there a point within the region, within public health, where you would make the decision to maybe close things back down, even before maybe the province says no? Like, has there been the conversation of, at this point, when we see this percentage of an increase in the growth rate or something like that, we would have to call it?
Yeah, that's always a possibility. But there's no hard and fast rule about that. We look at a number of indicators, the number of new cases, the state of outbreaks, and other factors like the percent positivity of tests, also what we're hearing from our partners in the community in terms of the health system's ability to cope. As you may be aware, the health system's ability to cope, in particular the hospital's ability to treat patients, treat them in ICU, et cetera, is an important factor that the government looks at when it looks at
So here we go. I think Hsiu-Li is frozen. Is everyone else seeing her freeze?
Yeah.
Okay. Hsiu-Li, if you can hear me, we're just going to pause for a second.
For a region. Our indicators were all good indicators of cases, but obviously that's an important factor. Sorry, I think I was frozen for a bit there or something.
Yeah.
You kind of cut out after you were saying, you know, the system's ability to cope, to treat patients is an important factor. And then you froze for a bit.
Yeah, sorry. Yeah. So we would look at all those factors again to determine, you know, whether we needed to scale back some activity in the province. Of course, I would also be consulting with the chief medical officer if that happened in our region.
And just a quick question for Chair Redman. We know that the province was told last week that they will be getting $7 billion out of the deal with the federal government. And Premier Ford said on Friday that regions and municipalities will know within about a week how much money they're getting. Just wondering if you've been told yet.
No, we haven't. And as always, Kate, the devil's in the detail. Really pleased that both levels of government are participating. Really happy from a regional perspective that there will be some dedicated funding for transit, because that's been a huge blow to our financial outlook. Great news. Probably this money will get us through the next 6 to 8 months. And what we recognize is the modeling tells us there may be a second wave. You were just asking about maybe going, you know, back into something that looked more like phase 2. So we recognize that 2020 will be a tough budget year. 2021 and probably 2022 will be equally as challenging. So thrilled with the investment. Don't have the detail yet, but very much looking to continue this partnership with the senior levels of government to provide services and not raise property tax at a time when people are probably least able to pay.
Great, thanks. Those are my questions, Bethany.
Great, thanks, Kate. Okay, so let's move on to Damon. Go ahead, Damon.
I actually don't have any questions right now. Thank you.
No problem. I will pass it over to Joanna then.
Thank you. Just wondering, are you guys collecting numbers related to the mask bylaw and complaints or calls, and will those specific numbers be shared?
So you froze a little bit, but I think I got your question. Feel free to chime in, Karen or Hsiu-Li. We are collecting some analytics around calls. The numbers that I have that I read out a few minutes ago is 438 questions and complaints. I don't know the distribution between phone calls, emails, and website form, but I do have that there are 350 questions and 65 complaints. So I don't know if that gives you what you're looking for. I have some other numbers around security interactions at regional admin buildings, just that there have been 143 encounters, but generally that's just security providing education to people who are visiting our buildings and just reminding them that they need to wear a mask.
Right. And would you know, like, have there been sort of confrontations that had to be responded to, like people saying, you know, I saw this person, they weren't wearing a mask, and then confronted them?
No, so we actually haven't had, that I'm aware of, we haven't had any bylaw officers going out to calls for confrontations. There's been a lot of education. Anecdotally, I'm hearing that we've had really, really good compliance. People have been pretty good about wearing masks. Certainly there are people who disagree with the bylaw, and there are people who have questions, complaints through, you know, various ways, through social media, phone calls, etc. But overall compliance has been really good. There haven't been any negative encounters through our bylaw or security officers, if that was your question.
Yes. Joanna, if I can just add, I mean, I am still getting emails from people that fundamentally don't agree with the mask bylaw, but I think people are also hearing on the news that it is becoming a very common, widespread practice. So whether you're leaning into this willingly and putting your mask on because you recognize that there is a benefit, or you're sort of doing it reluctantly because it's mandatory, people are now looking to see that it's a very widespread practice. And even the major networks from the United States are talking about how much wearing masks helps as part of the protocol that you can use to stop the virus from spreading in the community.
And Joanna, just to add one more item to that, we're continuing with public education, and we're hoping that that helps a little bit. We've been doing digital and radio advertising. We have had over 50,000 visits to our mask bylaw pages on our website. We're doing a lot of social media and providing resources for businesses. So we're hoping that that public education helps as well.
And overall, I guess, Chair Redman, this question is for you. You feel good about compliance and sort of just the general approach to the bylaws in the community?
I do. I would have to tell you that it was a productive conversation with Dr. Wang in public health when we decided that we would go the route of a municipal bylaw. And it has always been acknowledged that we're not heavy-handedly enforcing this. We're using it as education. But Dr. Wang's always been very supportive of wearing masks. And for us, it was really important that we didn't put businesses in the position of having to enforce it. So we've tried to look at this as a partnership with business. And again, Dr. Wang said repeatedly that one of the reasons why we've always been able to move immediately to phase 2 and now to phase 3 or stage 3 is the fact that we've had so much cooperation within the community, again, making personal sacrifices for the greater good. And that appears to be holding strong and continuing. So it's very encouraging.
Okay,
Yes,
thank you.
Sorry.
Go ahead.
Sorry, to quickly add, I have been very impressed and very grateful for what I've seen. Waterloo Region residents have continued to follow the recommendations that have been put out, and not only the previous recommendations, but also in terms of complying with the new masking bylaw. So I'm very appreciative. I have seen myself anecdotal evidence of very high degrees of compliance, and I've also received emails like Chair Redman where businesses have thanked the region for making the onus to comply with the bylaw on all of us, as opposed to only businesses. So I'm hopeful that's also a factor that helps in making everyone in our community understand that, again, it remains a collective responsibility for all of us to continue with these practices.
Okay, thank you.
Thanks, Joanna. So I will look around the screen and see if there's any follow-up questions. It doesn't look like there's anything, so we're done. So thanks, everyone. Just a reminder that we're doing these once a week, so we'll see you back here next Tuesday. Thanks, everyone.
Bye, everybody.